It's the Eagle Community Television Forum with your host, Gary Shorman.
Hi there. Thanks for joining us here on the Forum on Eagle Television. Our forum is brought to you by Hayes Med. Our guest today is Kerry McCue, and Kerry heads up health services for Ellis County. He's the director of that organization, which really covers a broad part because, I keep thinking that EMS thing for you. What do you cover now under health services? What's under that division?
As in the past, Ellis County EMS and then the Ellis County Health Department. As of the first of the year, January of 17, Butch Slyer retired shortly before that, and the commission looked at ways of helping reduce the budget, and they asked if I would take the health services on and do both EMS and the health department, and so we did that. We're going to see how this works out.
How did that go? What was the learning curve? Because your background is an emergency, that's ambulance and that, but health services kind of plays right into that same thing.
Yes, I'm busy, to say the least. I'm still trying to find the time commitments for both departments. What I thought the learning curve was going to be a hill has turned out to be really a ladder, because although they're both health services, they're different types of services. EMS, in which my background is is a reactive type service, where the health department is a proactive, wellness, those types of things. And so it's a steeper learning curve than I thought it was going to be. But I've got great people in both departments, and they're helping me a lot and directing me in the right way where I need to go. And so it's been a good change.
Well, one of the things, you have an advantage of seeing the other side, so the proactive side of keeping Ellis County residents healthy. Mm-hmm. And some of that ties into some of the things that are out there right now, which is the reason we started this program and kind of came into play here, is because there's been some of the, I'll call them like mumps, measles, some of those things, specifically mumps, that have been showing up. And all of a sudden that falls under Ellis County Health Services, because how do we prevent that? Where do we find them? What do we do? How do we train people? And that's the reason for this program, Kerry. Tell us a little bit about mumps and where that is and what you're hearing about that so far.
Well, I've given my staff and our partners at Hayes Med that we've worked closely with a hard time, that they're baptizing me by fire with the mumps and the measles. And quite frankly, since I started, we've had both. We had a measles case that we investigated that turned out to be negative. And in the last 4 weeks, we've had 10 suspected mumps cases that only one of them has come back positive. But we have had those 10 that are either been investigated or currently ongoing. A little bit about the mumps. It's much like influenza. You treat it the same way. You have to come in contact with someone that has had the mumps, and they've sneezed on you, or they've sneezed on the shopping cart that they use at Dillon's or Walmart. So it's very important that you practice proper hygiene things, and the sanitary wipes. Wipe your cart off when you go, sneeze in your arm and those kinds of things. Wash your hands when you do sneeze, and blow your nose, those kinds of things.
So if you're out there listening to that, take note, because a lot of the stores are very good about having those wipes to be able to clean off your cart, and some of us, just myself included, just sort of run in, grab something, away you go. But it's important to make sure you do have the right kind of hygiene to go along with that. Is that the number one way to help prevent the spread?
Well, also it's important that you have your vaccinations. And
that's the MMR?
The MMR, and those are when you're young, usually before 6 months, the first one, and then before kindergarten, the second one. Some of the authors are talking about maybe a third one down the road. We don't know what this outbreak will bring us, but there's some discussion in some of the literature about maybe needing a third one. We'll see what comes out. Although if you do have the MMR, you're not guaranteed you're not going to get the mumps, but it's 9 times less likely that you are going to get it. And if you do get it, it will be less severe than if you didn't have the vaccine. So if you've come in contact with that person, it's about a 12 to 25 day, depending on the author you read, period from the time you came in contact with that individual before you'll start seeing symptoms. Average is about 16 to 18 days.
And so what are the symptoms?
You have swelling. It's much like a cold. You'll have sore throat, you'll be fatigued, you'll have just regular cold-like symptoms. And you'll have swelling in your, it's actually a swelling of the saliva gland. You'll have this swelling in this area. It's important you see a physician. They'll restrict you to 5 days of isolation, and you are contagious from 2 days prior to the sign of symptoms and 5 days after. That's why after you've seen the physician or your provider, then it's important that you're isolated for 5 days. So those 7 days, 2 days prior and 5 days after, you are contagious. So we want you isolated away from anyone.
So don't go to work, don't go to school, don't go to any place like that if you feel like you're sick.
And as I said, we've had one positive case, and that individual has long been out of their 5-day period. So have no idea, we haven't seen to be able to track down where that came from. There was a rumor going around, and there's some discussion that maybe it's tied to wrestling tournaments. I haven't seen any concrete evidence of that. There were 2 cases in Thomas County that were both young men that were related to that, but what we've seen,
What about the rest of the state? You talk about there, but there I've heard across the state, and really across kind of the Midwest, there's been more of the mumps.
There's lots of cases. There's been cases in Johnson and Douglas and Great Bend in Barton County, Thomas County. And,
it's not in the millions, but it's in the hundreds,
yeah,
right?
There's a case right now, or has been a confirmed case in our neighbors to the north in Rooks County. So there's lots of cases going on. There's lots of speculation why those cases have all of a sudden popped up. You know, were we lax in giving our MMRs or our vaccines? Were we lax as parents and not giving them? Did we give enough? That's why I said there's some literature out there that are kind of pointing towards maybe a third or a booster. So we'll see how that comes out.
Well, let's talk about that a little more. We're going to take a break, Kerry. We're going to come back. We'll talk about some of the state requirements for the vaccination and what that means. And maybe if somebody wants more information, where do they go? Okay. How do they find you? How do they find your team to make that happen? Our guest is Kerry McCue, who's Director of Ellis County Health Services. Back with more after this.
Hayes Med is your first and best choice for healthcare. They're the only facility providing tertiary level services in this region. With more than 70 physicians and 26 specialties ranging from heart, orthopedic, spine care, cancer, obstetrics and gynecology, wound care, rehabilitation and surgery, including the Da Vinci robotic surgery, Hayes Med is your comprehensive health provider for people throughout Western Kansas. Hayes Med, helping people be healthy.
Are you frustrated with Wi-Fi dead zones in your home? It happens when you don't have Pulse, the cutting-edge Wi-Fi solution from Eagle Communications. A Pulse-certified Eagle technician maps your home, then installs a dual-band modem and router, plus discrete access points to deliver wall-to-wall Wi-Fi with no dead zones. Pulse powers all your family's devices in all the places you love to live. Get Pulse. Wi-Fi made simple. Only from Eagle Communications. Call today.
Welcome back to the second half of our forum program here on Eagle TV. If you have any questions about today's show, any comments or ideas for future programs, you give me a call at my office, 785-301-2082, or you can reach me via email at gary.shorman@eaglecom.net. Again, it's good to have you watching. Our program is brought to you by Hayes Med. We talk about Hayes Med, well, we talk about mumps. We talk about Kerry McCue, who's head of the Ellis County Health Services Department. And we were talking about mumps, all that going around. I just was checking some facts that I had, and it shows over 4,200 of cases across the United States that have had mumps. And of course, a good number of those, or at least some of those, have been from Kansas. The state also has some requirements about when you're immunized as a youngster. What are those requirements, Kerry, and what does that mean before they go to school?
Well, the first MMR is after a year of age, so commonly 12 months to 15 months. And then the second one is followed after the age of 4, but commonly before they go to kindergarten. So in those time frames, depending on how it works out for the parents. I will also say that it is a requirement by the state of Kansas that before that child enters kindergarten, that they do have those 2 MMRs.
And that's to not only protect the child, but to protect others that are in the school itself, correct?
And hopefully we'll prevent some of the stuff that's going on now with the number of cases that we're seeing.
Okay, so somebody's watching this and they don't know. As I have it down here, I think if you're older than 57 and you don't know if you've had an MMR, you can go in. Where do they go to find you, find your team, and say, hey, I want to be protected at least as much as I can be? Where do they go?
Well, you're correct. If you're born after 1957, you're considered to have had mumps.
Okay.
And you're considered to be immune. If you're born after 1957, then you need to contact your provider. You can contact your provider at Hayes Medical Center or in one of the clinics, wherever you see your family physician, or you can contact us at the Ellis County Health Department.
And then provide the information in the background to go along with that. What all do you see? I'm going to switch from mumps a little bit, but what all do you see at the health department? You know, in the emergency room, or the emergency side of things, you know, you and I talked several times, we looked, you know, the ambulance, all that, it's very mechanical, go pick people up, get them to the hospital, all that sort of thing. When you, on the other side, how broad is the scope over at the health services department?
Well, you're exactly right. The EMS side, there's lots of moving parts over there because we have 3 stations and there's 8 people on 24 hours. So that's a busy agency. On the health department side, they're busy too. We do really well with the WIC program, the Women and Children. There's lots of clients that come in and see our nurses for the WIC program. In addition to that, they do immunizations like MMR. We do lots of allergy shots. And we do some education, lots of education with the WIC program. And so we have a broad range of services that we do provide.
You know, one of the things I know, shingles is one of those things, just an example of those things that, you know, that you can prevent by having the shot or the vaccination. And everything's not 100%, but you guys will help people, coach them through what's good, what's bad, how you make that happen if they just drop by your office. And some of those things can just save you a lot of struggle and weakness and health related things, and especially if you're traveling somewhere and all those sort of things.
We would recommend that you call before you come, but if you don't see us, see somebody in the community, because it's important that you get those issues taken care of so that it doesn't turn into a more critical disease or, you know, in this case, the mumps. You've been vaccinated and hopefully it will prevent. There's lots of allergies that we can help you with shots and hopefully reduce those effects of that allergy.
And you did mention our healthcare community. We have a great group of not only doctors and hospitals to help. So if you have a question, you're sitting at home, not feeling right, you feel something's wrong, you suspect something, there's a lot of opportunity to find somebody to help and not just go back to work or send your kid to school when they have something that's going to infect others.
It's better to be safe than sorry. You need to seek some help somewhere in the healthcare community.
Very good.
And we're just part of the whole healthcare community. We're just part of that network.
Very good. Kerry, thanks for being here. Congratulations on the new position of getting
Thank
to
you.
step up and do twice as much.
Thank you.
Gotta like that. Kerry McCue has been our guest. He's the director of Ellis County Health Services. You've been watching The Forum here on Eagle Community Television. It's brought to you by Hayes Med and by Eagle Communication. Our community connected.
It's a beautiful day in our super high-speed internet great customer service neighborhood. Like you, this is where we live. In fact, our company is employee-owned, so it's our goal to improve the quality of life for everyone in our community by delivering faster, more reliable internet, clearer, more feature-laden phone service, quality TV channels, all with the level of customer service you'd expect from people who are your neighbors. Eagle Communications, our community connected.